Chapter 7, Health Promotion During Early Childhood. Toddlers are trying to reach autonomy by attempting many new tasks. They have a ton of energy and are very curious. The preschooler becomes more independent as mastering many new skills. They are imaginative, curious, and creative. Many parents say this is their favorite time with their children. The toddlers have immature abdominal muscles which make their bellies protrude out. As they grow and move into the preschool age, this will go away. Many times they look bow-legged and their legs seem to be short for their stature. This will also change as they grow. They will lose their baby fat as they get closer to the preschooler age. The preschooler grows more rapidly in legs, so they appear more leaner. Their appetite tends to decrease as well. Nutrition is important as it will help the muscles grow and strengthen. The lungs will become larger and the respiratory rate will decrease. All 20 deciduous teeth should be present by age 3, and many will start to lose teeth by the end of the preschool years. One of the biggest motor development of the toddler is mastering walking and running. The age the toddler learns to walk can vary. Some kids will walk as early as 9 months. Most can walk independently by 15 months. By 18 months, most are running, but they do fall a lot. This is due to their short legs and that bow-legged appearance. Around 15 months or even earlier, they like to climb. They will try to climb anything and everything, so safety is a key component. They're very fast at climbing, so it doesn't take long to be on top of a table. Many will try and climb out of their cribs, so that may be time to move them to a regular bed. Their fine motor is improving as well as their eye-hand coordination improves as they move through this stage. They want to feed themselves, and they need to be able to be given the opportunity to feed themselves. Yes, it's going to be messy, but remember, this is the time of autonomy, and they need to be able to do this. Most will be able to eat from a spoon by their 2nd birthday. By 18 months, they can undress themselves, and many will do this frequently throughout the day. By 24 months, they can put simple items on as well. They should be able to zip large zippers, put on shoes, and wash and dry hands. We need to encourage the parents to allow the child to do this, even though it takes much longer for them to complete. The preschooler has increased muscle strength and their coordination will improve. You will see less falls from running. They can do many gross motor activities. Typically, the more opportunity or practice time they have at these activities, the better that they will become with them. By age 4, right or left-handedness is determined. Encourage parents, if the child is left-handed, to get things made for left-handers to make it easy for them. By age 4 to 5, they can independently dress, eat, and go to the bathroom. Toddlers between 12 and 18 months are in the sensory motor phase of Piaget. They learn to do things by trial and error. They may have a big stack of blocks and want them all to fit in a box, but the box is too small. They don't have the ability to look at them and know that they won't fit in that box. They also like to imitate what others are doing, especially parents. They will also repeat things their caregivers say as well. Their concept of time is still immature. They do well with routine. When referring to time, use something they are familiar with. Mom will be here after your lunch or nap. They won't understand what 4 o'clock means. They will then move into the pre-operational phase. They will start to use symbols to know things. They will become imaginative, and they love to use a box and make it into lots of different things. Towards the end of this phase, they can see the consequences of their actions. The preschooler by age 4 can retain a mental image of a loved one. They can engage in animism. This is where they believe non-live items are alive. They also experience magical thinking during this period. They think their thoughts can cause events to happen. For example, they may have wished something bad would happen to their brother, and then if the brother gets sick, they feel that it was their fault. Or they think they are sick because they were bad. This period is for rapid learning as well. The age at which children begin to talk can really vary, but they can verbally communicate by their 2nd birthday. The child needs that interaction and reinforcement to help develop those verbal skills. A child that has older siblings that does all the talking for them may not be able to talk as well as a child who speaks for themselves. Many understand many words and that they can verbalize. Parents can help by talking to their child continuously throughout the day, telling the child what they are doing. At dinner time, tell them what's for dinner. Tell them to use their fork to eat their chicken, and other things like that can help them to develop a good vocabulary. The preschooler does a good job with verbalizing their needs during this stage. Sometimes you'll even notice them talking to themselves. At 2 years, they have a vocabulary of about 300 words to over 2,100 words by age 5. This is a huge increase. 3-year-olds will use shorter sentences, and many times they talk to their imaginative friends. The 4-year-old talks a lot and may tend to exaggerate when talking. This man was as tall as our house is an example of that. 5-year-olds speak in sentences like adults do. They're pretty good at storytelling, and many include fantasy in their story making. It's hard to believe what they are saying. The 5-year-old can recite the days of the week and name of the seasons. Reading to children and having them watch educational programs can enhance their vocabulary and verbal skills. They ask how and why frequently. Remember, the toddler is trying to reach autonomy, but in order to do this, he must have received trust during infancy. Once that is established, the child can have periods of being away from the parent and attempting new tasks. If a toddler does not try to do new activities and build that autonomy, they will stay dependent and experience shame and doubt. At about 15 months old, toddlers will develop negativism. This is displayed by saying no frequently so they do not have to do things. It's their sense of control. Many times they do not even understand what they are saying no to. One way that we can help parents with when their child is going through this is to offer less choices that can be answered to no. For example, do not ask them if they want an apple for snack if that is what you want them to have. You're giving them the opportunity to say no to that. Instead, say, would you like an apple or an orange for snack? That way you know they will get some sort of fruit for snack. In regards to you as a nurse, you can do the same thing with medicine. If your patient needs to take Tylenol, do not go into the room and say, do you want to take your medicine now? You are giving them that opportunity to say no. Instead, say, do you want your medicine in a cup or in a syringe? Or do you want me to give you your medicine, or Mom? You are still offering choices, but you're going to get the results you want. Ritualism is the other thing toddlers will go through. They like routine, and that means they want the same cup or plate or bowl all the time. Recommendations is if the child always eats their dinner on a certain plate, you should take that plate if you're eating elsewhere. When children are hospitalized, their routines get very messed up. Try to accommodate and stick to the routines as much as possible. Separation anxiety peaks for the toddlers. They have a hard time with the separation. Warning the child ahead of time can help. Also, we can assure that the parent, is coming back. Play is very important to the toddler. They do it most of their day. They engage in parallel play. See box 7.1 for age-related activities. By age 3, most can differentiate between genders. Preschoolers in Erikson's stage of initiative versus guilt. The preschooler takes great pride into trying new things and completing projects. Parents that offer support and praise them will reach the initiative stage, so they're not afraid to try and complete new things. If the child is always made inferior or like they are never doing it correctly, they will experience shame or guilt, and they will no longer want to try new things. We are not encouraging the independence that they need. Preschoolers play a lot too. They need to play with others to learn how to relate. They may be more argumentative around age 4, but that is normal. It helps them deal with conflict management. They will outgrow that and have more cooperative play. They will start off doing parallel play, but then they move into associative play. They learn to share and cooperate during preschool stage. Imaginary friends are common at age 3. Nutrition of the toddler and preschool are similar. See box 7.2 for the healthy snacks and box 7.3 for increasing nutritional intake. They typically are not iron deficient, but if milk is their primary food, they will not take in iron-enriched foods, so they may have issues. When determining how much of solid foods a child should be taking, a general rule is 1 tablespoon of food for every year they're old. Offer foods of different colors, textures, consistencies, and temperatures. We still need to be careful of choking hazards that we talked about before for children. Age-related challenges include food jags. This is where they want to eat the same food 3 or 4 days, and then all of a sudden they refuse that food. They can be picky on the order their food is in or the temperature of the food as well. Neither too much milk or juice is good for the child. Both toddlers and preschoolers should only have 4 to 6 ounces of juice a day. Role modeling and making a variety of foods available can help the child like more foods. Physiological anorexia is when the child may be going through a spurt of being picky and have a decreased appetite. Being sure the child doesn't fill up on snacks or foods with little nutritional value can help. Use small portions so you won't overwhelm them. Teach parents to focus more on weekly nutrition instead of daily nutrition at this age. Risk of obesity is a big problem right now. Offering more fruits and vegetables to decrease fat intake and add fiber can help. Adding more whole grains can be beneficial as well. Decreasing fat, sugar, and salt intake is also recommended. All teeth should be present by age 3. Toddlers are not able to brush their teeth well enough, so parents should be brushing their teeth first and then allowing the child to brush after that. Toddlers and preschoolers should also have regular dental visits at the dentist. Preschoolers can usually brush their own teeth, but parents should be monitoring for good technique. Toddlers often resist going to bed and may have temper tantrums at bedtime. Being consistent and firm is the key. Giving a warning a few minutes before bed can help, and having a bedtime routine is also helpful. Preschoolers need adequate sleep due to how busy they are during the day. Keeping a routine can help as well. They also may need a transitional object. This can be a favorite blanket or stuffed animal. They can really help if they are hospitalized. Having something familiar will provide security. Encouraging parents to bring that transition item to the hospital can make the child feel more secure. Sleep problems are more common during the preschool years. They're so imaginative that many times they have a hard time telling the difference between real and fantasy. Night terrors are when a child is in a deep sleep, they remain asleep, but their eyes remain open, and they scream or moan, and they do not recognize the parents. It can be hard to console them. Keeping a nighttime ritual can cut down on the sleep disturbances. Having them in their familiar sleep environment and keeping a nightlight on can also help them feel secure. The nurse can help by assessing the nighttime rituals and educate on the importance of routine and the transitional object. Also, encouraging them to use the nightlight and not make them stay in a darkened environment when they are scared can help. Various forms of discipline can be used. For toddlers, many times positive reinforcement for positive behavior can be effective. Diversion is another method. Timeouts also can be used. Do 1 minute for every year old they are. Being consistent is a key. You don't want parents to just give warnings all the time and not follow through with it. For the preschoolers, setting appropriate limits can help. Telling them if they do not get dressed by the time the timer goes off, they will not be allowed to watch TV or something like that. Be specific with the consequences that are going to be. Don't just say if you don't get dressed, you're going to be in trouble. They need to know what the consequences are going to be. The same form of discipline for the preschool as a toddler. Reinforcing good behavior is always something parents should do. Once again, be consistent and follow through. Toddlers need to remain in a rear-facing car seat in the back seat until they are 2 years old or meet the height and weight requirements. After 2, they can be in a forward-facing seat made for that age and placed in the middle of the back seat. See the safety alert box for more guidelines. One education piece to provide to parents is each time they get into the car and the child is not with them, they need to check the surrounding areas around the car. Children like to hide or maybe playing around the car and not visible once the adult is inside the car. Burns and scalds are a major cause of injury in the 1 to 4-year-olds. Remember, they're very curious and don't understand the consequences of their action, so they may pull things off the counter that are hot, turn the hot water on, pull a pot of boiling water on them. My daughter, when she was 3 years old, had a stool next to me when I was cooking and saw the red on the burner from being hot and thought it looked pretty, and she touched it. I was standing right there and it happened that quick that I couldn't stop her. Using the back burners, turning handles away from the child's reach are a few things that we can educate on. Kids at this age are very curious about lighters and matches, making sure they are out of the reach of the children. Remember, they like to climb as toddlers, so just leaving them on a countertop is not good enough. Falls are a high risk for toddlers. This is due to how much they like to climb and they are curious. Education on these things to prevent include close supervision at all times, moving furniture away from items that they can climb on. Water safety is crucial at this age. Most toddlers love the water, so they're very curious. They should be never left unattended at a bathtub, pool, near a bucket of water. They can drown in a bucket that has 1 to 2 inches of water in it. Providing parental education on gates around pools need to be, and that the pools need to be closed, and the gates need to be closed and locked at all times. Teaching parents sometimes that the locks need to be placed on the door near the top so the kids cannot reach. They can figure out how to unlock things very easily, so it's not always enough to stop them. Preventing poison control is another big area of anticipatory guidance we can give parents. This goes along with baby-proofing the home. See the patient-centered teaching box in your book for prevention tips. Just keeping medications in a cupboard is not enough most time. It needs to be in a locked container also. Kids also get into mom's purses so they can get medicine from there. Once again, supervision is always needed. Educate parents that medication should not be called candy. Kids like candy and may want more candy, and try to get into the medicine. Preschoolers need to stay in a car seat until at least 4 years old, or they meet the required height and weight requirements. After that, they are moved to an approved booster seat. Being sure that the seat is fitted properly and that the shoulder strap is used correctly is an education piece we can provide to the parents. Preschoolers can understand a little more about the concept of fire and burn, so educating them is important. They like to imitate what parents do, so they may want to surprise parents and make breakfast and try to use the stove. They're at risk for burns or death from a house fire, so educating them on fire safety and teach them the plan on how to escape if the house does catch on fire. Also teaching them the concept of stop, drop, and roll if their clothes catch on fire. Firearm safety is crucial at this age. Many kids are fascinated with guns and really have no concept of what can happen if they play with them. Nurses should talk to kids about gun safety at child checks, asking parents if their guns are in the house, and reinforcing proper storage of being in a locked cabinet at all times and locking up the bullets as well in another location. Assessing for sexual abuse is something the nurse should do. Please refer to the book on the area on sexual abuse to know the areas to look for. Kids need to know if something is happening they do not like that they need to tell another adult.